Hi everyone, welcome to week 7 of your Math for the Medical Environment course. This week we're going to be covering two sections in your textbook. We're going to be covering section 7, which is all about measurement instruments. So that's going to cover units 28 through 34. And then we're also covering section 8, which is graphs and charts, and that covers units 35 through 37. So basically what we're going to be doing is looking at the different measurement types of measurement instruments and then using charts that go along with those particular measurement instruments. So that's what everything you're going to be covering is. So make sure that you're looking at all of the units this week. Just another reminder, section 7 is unit 28 through 34. Section 8 is unit 35 through 37. So there's a lot of slides that I've provided you that go along with your textbook this week, but there's a few things that I wanted to point out on these slides rather than go through every single one of them with you. The first unit is all about using rulers or tape measures, and so that one's pretty straightforward. Most of you have probably had experience with that. It's used to measure height, used to measure length. Obviously, depending on who we're measuring, we're going to use a different tool. The tape measure is typically what we use for the infants. We can also use that to not only measure their height, but also circumference of their head and things like that. When we talk about measuring children and adults, usually what we're looking at is what they call a height beam. So it's a scale that's typically affixed to the wall, and we can pull it up and determine the patient's height. So that's what this first particular chapter is about. Second unit. Second unit is about scales, and scales are used to measure weight or mass. So most of the scales nowadays are digital, so there's not a whole lot that you have to worry about reading a scale, but they are going to talk to you about how to read an infant scale, how to read a regular scale that's used for an adult. So you do occasionally run across those types of scales, but for the most part you're going to run across digital. Same way with thermometers. They're going to show you the basic principles of reading thermometers, but of course nowadays most of our thermometers are digital, so there's not a whole lot we have to worry about there. Now, unit 31, and let's see how I do with this, is all about the sphygmomanometer. Sphygmomanometer is the blood pressure gauge. So when you're looking at this unit, this is all about measuring blood pressure. Again, a lot of electronic devices out there that will do this for us nowadays, but there are probably a lot more docs that you're going to see that do it the old-fashioned way rather than with the electronic. So learning how to measure blood pressure. Keep in mind the whole idea of the systolic and the diastolic. That's what we want to keep in mind is, what is the range? Normal for systolic, which is the top number, is going to be anywhere from 100 to 120. And then the normal range for diastolic, which is your bottom number, is anywhere from 60 to 80. So, more than anything for this particular unit, learning what the norm is really important. The next section is unit 32, and it's all about syringes. This one's really important as well because there's different types of syringes. So you're going to look at a 3 milliliter syringe and how to measure with that. They're going to actually show you an example of one and show you what the markings indicate. So pay specific attention to that. If you need to, save that picture and blow it up on your, computer where you can read a little bit better. The next type of syringe that they're going to be showing you is the TB or tuberculin syringe, or the low dose syringe. So these are what you might see for pediatric patients, heparin, things like that. And so again, they're going to show you a picture of what one should look like. And the last one you're going to look at is the insulin syringe. So when you look at the insulin syringe, it is measured differently. So if you look at this, you can see how it's measured in units. So this is a U100 syringe, so it's measured in 100 units. And then they show you what the breakdown is on each of the calibrations. Then from there, we're going on to the urinometer. A urinometer is used to measure the specific gravity of urine. Why do we need to measure specific gravity? Specific gravity helps us determine whether or not a patient's dehydrated, how their kidneys are functioning. So that's the significance of specific gravity for urine. And then the last one in this particular section is the microhematocrit centrifuge. So this one is it's a blood test. So basically we're going to measure the amount of red blood cells in the blood. So that's what this particular tool does for us. Then we're going to move on to section 8, which is units 35, 36, and 37. And this is where you're going to be looking at graphs. So as you go through these, you're going to look at all of these different types of graphs. Measuring temperature, pulse, and respiration is the first one. I&O charts is the second one, and height and weight graphs are the third. Height and weight graphs are typically used to determine what percentile someone is in as far as their height and weight. Intake and output is obviously just what it sounds like, measuring what the patient is taking in and what they're putting out, so that we can monitor that as well. So as you go through this week's two sections, section 7 and section 8, if you run across anything at all you have problems or questions on, please make sure that you reach out to me, and have a great week.